find out now from Health MEC Gwen Ramokgopa about the plan and what's happening at the moment. MEC, good morning, and thanks for coming in this morning. I mean, you have already enough on your plate, as we can see with what's happening. Give us an update on that plan. We heard the Health Minister talking about it. Where are we with the plan to deal with this outbreak this morning?
Okay, the most important thing is that we received an interim report by the National Institute of Communicable Diseases because this is a multi-drug resistant bacteria, which is klebsiella. So it doesn't respond to the ordinarily used drugs. So the important thing was to contain the spread, which is now contained. We haven't had additional infections from the initial cohort. And secondly, we have been separating all new infections, all new babies who come in, admissions. But now, with the report from NICD, our decision is that we must ask Nelson Mandela Children's Hospital to be the host hospital for all related maternal and neonatal services, meaning that we're going to close down the maternity ward as well as the neonatal ward at Thelleo Mogoerane. All admissions for Thelleo Mogoerane will go to the Nelson Mandela Children's Hospital. So we've been there yesterday, we've looked at the site, and we think that it is possible, and some of the mothers will go to Charlotte Maxeke Hospital in the interim. One of the contributing factors also is that there is a passage that goes through a neonatal ward to theatre for mothers. So we're going to also have to divert that so that neonatal ward is absolutely secured in terms of infection control.
Now, MEC, the other hospitals that will be taking on the load for you,
yes.
Obviously just to allay fears of those who are there or those who have their children there, that their kids won't be infected, or any babies there might not be infected. Just the precautions that you've taken for that. And Charlotte,
yes,
as well.
Currently there is there's a team of specialist pediatricians called neonatologists. They are assisting Thelleo Mogoerane Hospital pediatricians there. And as I've said, we have quarantined in a way in separate wards those that are affected, and they are receiving very high level antibiotics because the bug is resistant to ordinarily used. So at the current moment, those affected are not mixed at all. And that's part of disease prevention and outbreak management system.
Have you managed to track down the source of this particular outbreak?
Currently, we have not been able to track down the source, and we are working with the National Institute of Communicable Diseases, and that's why once we've closed for the hospital for any new admissions, we will also be what we call scrubbing down, meaning disinfecting the whole ward, and not only the side wards that have already been decontaminated. So it is a process that we've been busy with, but now the drastic intervention is to close the hospital for any new admission, and all admissions for Thelleo Mogoerane will now go to the Nelson Mandela Children's Hospital, and Charlotte Maxeke will help with also having mothers there.
So this has nothing to do, or does it have something to do with hygiene at a particular hospital, or is it something that is brought from outside in general? Where does it come from?
Generally, klebsiella, you find it in a number of people, but it usually doesn't make people sick. But once it gets into the lungs, it gets into your blood, or even in an open wound, that's when it becomes one of the deadly bugs. But the bug that we're dealing with in particular is of serious concern because it is multiple drug resistant. It doesn't respond to ordinary drugs that are used. And that is why we are specifically worried about this one. But the intervention should be able to contain the disease, especially to only those that are affected, and some have begun to respond to a high-level drug, which is colistin, which is a Section 21, meaning that you apply for it specially to deal with multiple drug resistance.
So you also have very devastated, angry parents, I would imagine, at this particular hospital after this particular incident. Are they, do you know, holding the hospital responsible? Have you had any communication with them around this? They've lost, 6 babies have died.
What usually happened, the NICD, National Institute of Communicable Diseases, attributed the possible underlying factors, although, as I say, we haven't as yet got a source, to one, overcrowding. And in our hospitals, especially public hospitals, you can't send a mother away, or you can't say, mother, I can't admit your baby. Particularly in this hospital, 61% bed capacity. We had about 90 admitted at the time of the outbreak. Secondly, is that many of these babies, if not all, are very low birth weight. So they are also very susceptible. And the other important thing is the type of the bug. Because klebsiella is there in any hospital anywhere in the world. It is this type, this strain. Yes, the strain that affected the most. The hospital has interacted with the parents to explain, and I think they are also free to get independent advice in this regard. But we are sparing no effort to ensure that there is no further spread and that we decontaminate the whole of the ward.
So the health minister is saying that we need 6 new hospitals in Gauteng. I mean,
Most
are we going to be able to pull that off? How do we even begin to
Just to share with you, in 1999, when I came first time to Gauteng, the population was 7.5 million, and now we're 14 million. Gauteng is the only province that has over 1 million in migration from between the previous census. So urbanization, rapid urbanization is ahead of us, but you know, even the hospital itself is a new hospital, it's a replacement hospital. We've built even Steve Biko since 1994, but we have to be ahead of population growth, and we have no doubt that with the support of National as well, we'll be able to get more hospitals. We are also busy with there is a Davidton hospital that is planned.
So we're already in the planning stages. Okay, so we don't have to start from scratch at the moment with 6 new hospitals.
Yes, the areas have been identified, and we'll certainly make sure that we, with the support of National, ensure that we are ahead of urbanization.
Okay,
yes.
And maybe people should just stop having babies for a while. I don't know.
No,
don't stop having babies.
No, no, that's not what we're saying.
No,
we're saying that
know.
we must support all mothers,
yes.
and when babies are small and ill, this is what we're doing. We are providing safe and high-level professionals to look after
everyone.
them. Yes.
Thank you very much. Wish you all the luck, MEC, with all of this, and we'll obviously get updates on the latest outbreak. Thanks very much for that. Well,